Okay. Okay. Next, we have the very elegant Professor Aixingzi Aili, all the way from Shanghai. She's the head of HIFU unit, the first affiliated maternity and infant hospital of Tongji University. She's the deputy director of the endometriosis group under the Shanghai Medical Association of Obstetrics and Gynecology. She's a member of the minimally invasive and non-invasive medicine committee under Chinese Medical Doctor Association. She's honored as the Woman Pace Setter of Pudong District in the year 2013 and 2014. Also acknowledged as one of the top 10 angels of maternity and infant care in the year 2016 and 2017. Now, as far as I know, HIFU is the spring of the sufferers of adenomyosis, and in Mandarin, 海服是妇女的春天，但是我觉得海服
是腺肌病的春天。
腺肌病的春天 ，OK， 对不起啊，哦，但是我觉得你是你的医院的春天，因为为什么你把那个海服刀已经推广的很多妇女都接受，所以很多妇女就排着队所以来看你，更谢谢你。
Yeah, it's true.
Okay. Well, this is a picture taken when I first met her in China, and her topic today is on HIFU experience in Shanghai First Maternity and Infant Hospital. So let's have Professor Aixingzi Aili to share her slide. Aixingzi, please, over to you.
Okay. Good evening, all my friends from all over the world. On this special circumstance of virus time, life is not easy for all of us, especially for all people who work in the front line. No matter what is happening, we as doctors should never stop sacrificing ourselves. Like today, we are still learning something. It's my great honor to be here to share some experience about HIFU treatment. This is the place I am staying now. I'm from Shanghai, the first maternity hospital. This is the beautiful Shanghai, and I hope in the future sometime you can come to visit us. Our hospital was built in 1947. It's really a very old hospital compared to some new hospital. At the front, this building I'm sitting on at the moment. There are some official information about our hospital, like the history, and we have 2 campuses. I am in East Campus now. And we have 2 huge buildings and a huge area, and our hospital in many medicine scientists also located in a very high level in China, like National Nature Science Foundation of China. Recent several years, our hospital in the top 1. Our hospital is famous for obstetric mainly. Every year, annual delivery quantity nearly 30,000 cases. And this is obstetric team. The head of obstetric, Professor Tony. I believe many of you can meet him before. And for gynecological team, the head is Professor Wan Xiaoping, who is full of ambition. He wants to create the top women's hospital in China. And the information show our HIFU cases ranked to #1 in Shanghai. But myself, I think there is no comparability because many hospitals still don't have HIFU equipment yet. We have many good teaching research and the clinical education also very well. And the HIFU system have been overprotein operating in 27 countries and regions. Like this map, the right side for hold, we can see many countries already have HIFU and they are doing very well, like Professor Li Jianwei, the APAGE, this conference sponsor. And the right side, the map, we can see the whole China already in everywhere. It's just like blooming firework. This is a Tele-Medicine big data center. When we do every cases, we will connect with them and keep every patient's very standard procedure and keep patients safe. This is the data from 2019. So from here, we can see our hospital in standard third level. Every year, we finish the nearly 500 cases. Beyond 1,000 cases include the Swinning Center Hospital. Many friends already visit there and know the HIFU knowledge. The second hospital is third Shanghai Hospital of Central South University, which is also very famous hospital in our area. Like Shanghai Hospital, the HIFU in charge by Professor Xue, who is all-around a very tough lady. Except HIFU, she is also on the top of robotic surgery. We are on the third level now, but I hope we can come to the first level. I want to quote the message from Zhong Nanshan. Choosing HIFU may be an accident, but once we choose this and make the decision, we will treat the patients with lifetime loyalty and enthusiasm. Very important thing to keeping one new technique. The loyalty and enthusiasm both are very important. So we begin from zero. Now beyond 1,000 cases, we get a very long journey from 2050 up to now. The main cases we done include myoma and adenomyosis. Especially our research direction focus on endometriosis and adenomyosis. Like adenomyosis, the very important thing before doing HIFU, the types is very important. Up to now, many doctors like to use the types created by Japanese doctor. These 4 types include type 1 is intrinsic, type 2 extrinsic, external, and 3 intramural. Type 3 like teardrop deformation of the rectum. And another type staging system also accepted by many doctors include diffusion endometriosis, focal adenomyosis, and polypoid adenomyosis and other form. MRI classification recently can be used by some doctors. It includes internal adenomyosis, and external adenomyosis. Internal adenomyosis include A to D. A means focal or multifocal adenomyosis. B means superficial asymmetric. C means symmetric adenomyosis. D is diffusion asymptomatic. And E, symmetric adenomyosis. A little bit complicated. And the second types from F to I. Solid, cystic, submucous, and subserous, little bit similar like myoma. External adenomyosis include posterior adenomyosis and K respectively with posterior and anterior deep adenomyosis. Recently, we put forward our research about the type classification. The first, we based on the traditional classification, focal and diffusion, and then divide into A, B, C. A means internal, B means external, C intramural, same as diffusion. Let's see the type 1, focal type, 1A. That means junctional zone boarding. There is normal muscular layer between junctional zone and the serous surface. Type 1B, there is normal tissue we can see between lesion and the junctional zone, and the lesion invade the uterine serous. Type C means there is boundary between intramural adenomyosis and the normal tissue. Diffusion type seem for A, lesion diffuse throughout the uterus and the junctional zone boarding, but there is normal muscular layer between junctional zone and the serosal surface. For B, lesion diffusion throughout the uterus and the invasive uterine serosa, but there is normal tissue between uterine cavity and junctional zone. This one maybe is good for pregnant again. Type 2C means lesion completely invade the junctional zone and the uterine serosa with diffusion throughout all the uterus. When we do the treatment, we divide it into 3 steps. First step is HIFU. Second step, like we already know, endometriosis and adenomyosis is uncurable disease. Also a chronic disease similar as like asthma and some chronic disease. So the second step, we usually use some different medicine. The very popular one is GnRHa, as all we know. We usually use GnRHa with remifemin. It's just keep the patient feel comfortable. The second very new medicine in China is dinogestam. The third one is a very old traditional medicine we call mifepristone. And the fourth one is gospel acetate. It's come from plants. Also the very good medicine to stop the menstruation. The third step is Marina. This is a paper we published last year about our treatment experience, combine the therapeutic effects of HIFU, GnRHa, and Marina for treatment of adenomyosis. So this is the best work of art. This is a very typical adenomyosis we will see. The first picture we can see the adenomyosis mainly occupy the posterior wall, the whole wall. And the second picture we will see 1 day after HIFU, mainly the lesion completely ablated by ultrasound. So I always call this our best work of art. The third picture we will see just after 80 days, happened a very big change. The huge uterus has miraculously regained its beautiful form after non-invasive gentle ultrasound ablation. So this is the first step. I will show the small video here. So the patient lies down and we will let the nurse clean the abdomen. The first step. The second step, we will measure the size of the lesion and also measure the blood supplement. So combine the MRI and the ultrasound together, like GPS guiding when we driving. So the MRI also very important guide. And the third step, we will say through ultrasound, we will keep the patient in very good position. We will see the bladder. Bladder is a very important organ during the HIFU procedure. It can protect the bowel. We should squeeze the bowel out of the area, the zone. So we will see the ultrasound penetrate through bladder, focus on the lesion. We will find a safe and a sensitive area to begin. So usually the very important thing is the first step. So we will find a good, very important area or good area and put the ultrasound, the source inside of the lesion, and then we will get the good result. We will see the grayscale change inside of the lesion. So this is sometimes depending on, we should have very good head. So this is a case we done just recently. The first second, it's very useful happen. We can see the first second mass coming. Here is some data from our research. The first thing, the pain related with patients' quality of life. We will see the VAS and the VRS score compare before and after HIFU treatment dramatically reduce. After 3 months, 6 months, and 12 months, keep very stably. Same as localized adenomyosis and the diffusion ones. Here is the menstrual volume score compared before and after HIFU treatment. Also, we can see the same two types are the same. The second thing, except the pain for the patient worry about is heavy menstruation, hypomenorrhagia. So it's very good. After HIFU, the patients can have a very less menstruation or normal menstruation. The third change we can see here, hemoglobin also can change dramatically. This is a third problem except the pain and the heavy bleeding is the hemoglobin. So we will, some patients from rural village, the very severe situation come to our hospital. Sometimes it's very hard to treat. And the third thing is the uterine volume. The uterus can change dramatically. We already showed our best work of art. The uterus can change very well to normal. The 5 good thing is CE125. This is also up to now the very important tumor mark to evaluate the degree of adenomyosis or endometriosis. Also can rule out some malignant evidence. So here we can see after treatment, 3 months, 6 months, the 1 year, the CE125 can reduce gradually to the normal level. So we get the conclusion, the 3-step approach of HIFU, GnRHa, and the Marina is a very useful technique. It's lower risk of hysterectomy. The second thing is also very safe, effective, and efficient. The third, it can improve the quality of life, especially for patients with localized adenomyosis. So I will show some the specific cases we done the last several years. The first one is very best one already showed in our paper. So pre-HIFU, 1 day after HIFU, and 80 days after. So we will compare it, see, it's changed to normal. Is that like a magic? The second case is another huge uterus here, adenomyosis. 1 day after HIFU, we will see it's a heart-shaped uterus. And 3 months later, we will see the shape of the uterus coming. We will compare. So from here, this is a 3 months change, also very beautifully. So what we will do for the right side picture, we will see something still inside of the uterine cavity. So the step 3, we will do D and C, but we did not do directly. We will through hysteroscopy. Like diagnostic hysteroscopy, we will see inside of the degeneration tissue. The right side picture, we will see the very clean, beautiful uterine cavity. The tissue pathology result is high-grade degeneration. This is also the evidence to rule out the malignant disease. And recently, we also find a very good method to do resection of endometrium. This video to show we do the resection for anterior endometrium. The second one is for posterior endometrium. So all we know, adenomyosis and adenomyosis, the main problem come from uterine cavity, the endometrium. So for those patients wouldn't like have baby again, no any desiration for pregnant after nearly 55 or even 40, we will do this procedure. Can destroy the all endometrium. We call it soft treatment. So no menstruation and no adenomyosis. Except the adenomyosis, the very useful treatment for HIFU is leiomyoma, diffusion uterine leiomyoma. All we know, diffusion uterine leiomyoma, DUL, is very difficult to treat. I meet a patient, she already done 5 times operation, open laparotomy. So herself did not marry and her whole family nearly crazy for operation. So for DUL, the operation is not the best choice. And also the big problem for the patient wouldn't like to do hysteroscopy. From this picture, we will see the right side picture is before HIFU. After 4 months, we will see the uterus come to a little bit smaller. The fourth case is also the big adenomyosis. 1 day after HIFU, we also can see heart-shaped ablation area. 6 months later, smaller, and 16 months post change a little bit normal, but the lesion little bit coming again. The case 5 also the severe dysmenorrhea for 5 years, also adenomyosis. But after ablation, we will see mostly the lesion already ablated very well. The case 6 is also the diffusion DUL, diffusion uterine leiomyoma. This is a very young lady, only 29 years old. So 1 day after HIFU, we will see mostly all the myoma ablated. And 3 months later, we will see the uterus coming smaller, much smaller. The case 7, also a myoma, 4 years of menorrhea. And we will see here the big myoma under the posterior wall. After 1 day, we will see the complete ablation. And 3 months, we will see the myoma already is very small. Nearly can neglect it. The case 9, also the best work of art, one of the myoma representative, the good effective treatment result for HIFU. This patient also had a menorrhea for 2 years. It's a myoma type 2, vaginal bleeding for 6 months. And we do the HIFU very beautifully. So we will see the result is very good. The myoma type 2 is also shrink very well. We will see in the right side picture, the myoma shrink to the nearly 1 centimeter. It's very easy to do the hysteroscopically move out. Case 10 is myoma type 3. So from here, we will say after HIFU, 5 months later, the uterus coming normal. This is very good result because the myoma is screwed out itself, no need to do hysteroscopically. Case 10 is a myoma type 4, intramural myoma. So we will see after 1 day of HIFU, beautifully ablation. 8 months after, we will see smaller, much smaller. And the case 11 for multiple myoma. This kind of type may be very common in our clinic. So this is the big myoma here, anterior, posterior area, the myoma. So before HIFU, we will see the huge uterus, the fundus nearly to umbilicus level. 1 day after HIFU, and we will see 3 months later shrink to smaller, much smaller. So we will see lower than the umbilicus level here. So the patients nearly near to menopause, so not necessary to worry about the myoma now. Now the menorrhagia, so the menstruation is normal now. So case 12 is DOL again. So this is a very hardest one. After treatment, we will see the normal uterus coming here. So we will see the big uterus shrink, normal size of uterus. The third setting, I will share HIFU to treat C-section incision pregnancy. Also the very interesting cases. Here is a embryo position. Right side picture is MRI. So we will see after HIFU, the surrounded embryo already ablated very well. No any blood supplement. So after HIFU, 3 days or 2 days is okay. We will do hysteroscopy. We will see the embryo inside of the uterine, and we will do the suction, can pull all the tissue out. The 14th case, I will share placenta accreta. This is also the big problem in China because we have so many patients had a C-section before, and when they have a second child, it easily happen. So the first picture, we will see the placenta here. 1 day post HIFU, we will see mostly ablated. And 4 months later, we will see the normal, beautiful uterus coming again. So not necessary to the hysterectomy. Case 50, I want to share a field case. So it's not all myoma can be ablated by HIFU. This is the cases we done 2 years ago. So we will see here the very shining signal here. 1 day after HIFU, actually we will see it's not too bad. The result is still is okay. The ablated area is enough for the myoma, but 23 months later, we will see it's come again. So we think for this type of myoma, it's not suitable to accept HIFU treatment. Last cases is really a happy ending. The first HIFU baby in our hospital. We will see from the right picture, there is a big myoma nearby the cervix. And this lady, when they pregnant, like nearly 30, she accept the MRI examination for the baby. Then we focus on the myoma, it shrinks smaller. So that is very nice for the patients with myoma to pregnant. So myoma is not like as usual if the patient did not accept HIFU. So myoma can grow with the baby, but after HIFU, it can stop growing or even can shrink gradually. So this lady is our first baby. So we always holding the human first idea. We established the Caring Uterus Club. In Mandarin, we call 爱公俱乐部. We are holding the spirit of human first. We established the Caring Uterus Club to help those patients who really want to keep their sick uterus, especially multiple big uterus, very severe diffusion, adenomyosis. We have many ladies. They wouldn't like accept hysterectomy. They want to keep their uterus. So we established many WeChat group like caring patients. The step one is WeChat. Like in China, WeChat is very popular. The patient can give us any information when they happen. So we will give the reply anytime. So recently, one patient said they feel the harmony, the friendly relation between doctors and the patients. They feel so amazing. And she said, managing emotion well is a good medicine to overcome the disease. So very important thing to keep the patients in the very normal emotion. So this is our the 1000th HIFU baby. Also the very beautiful babies here. So the patient said in our clinic can cure the disease and cure the heart, and also can beauty conveys love, but I'm not sure it's right. And here she said the medical skill is exquisite and beautiful and harmony. So the patient gives us confidence to move on to do the more to improve our technique. So up to now we have many medical platform. We call multiple self-media platform to serve to help the patient. In China, very popular one is Good Doctors Online, 好大夫在线. We also create many specific special group to specifically to help the patient any question. So this is a cake, and also I have the patient. She made this PowerPoint, this slide. She said that the pain and the sick and calm and live, and she means the disease is very pain. She has a very severe adenomyosis. So as a doctor, you should feel something same as the patient and to find a very correct and a very good way to help patient. The second is sick, and she said she sick many hospital, many doctors, and finally find me. She feel me like angel, but I don't think so. The third step is calm. Actually, it's kind of in China, the Mandarin Wu is means many things, very deep meaning is you should think something very deeply. The first step, the first is to live. You try to live well with a very high quality. So this is a beautiful lady. Also, she is the doctor also. So the trust of patients and peer is the driving force for us to move forward. This is a painting from my youngest son. Here we can see the crystal inside the uterus. Protecting uterus may defend the dignity of woman and creating more harmony life. This is my HIFU team. I have several assistants. They are very well. And I also have very three big and great women in my heart. First is my mother, very gentle, kind, and very brave lady, and she has 5 children, including me. I am the youngest. My biggest brother living in Istanbul. And the second lady is our very famous pioneer, Professor Lin Qiaozhi, who created and established Peking Junior Hospital, and cultivate my PhD supervisor, Professor Lang Jinghe, also an amazing hand in our house, whole China. The third is Mother Teresa. I want to use her words. We can't all do great things, but we can all do small things with great love. And welcome to Shanghai in some time, no any virus. I hope everyone stays safe and healthy during this difficult time. See you in the future. Have a very nice day. Good night.